Yes, everyone, welcome today. Today is Friday, 15th. The week has ended. We've been having a very long week, ups and downs, patience here and there, and it's good we do things the way it's supposed to be done. We have started another journey that we are dealing with complications directly related to not really to mental health but specific chronic issues that come out when people have problems. What I'm saying is the journey you have started is those chronic issues that relate to giving you problems mentally, physical issues like diabetes, hypertension, or arthritis, all of them. We have started dealing with them one by one because we need to learn about these diseases. They are diseases that you only manage, and treatment is hard. There are sometimes when you can be sick, you have a complication that you can only manage. You have a complication that you can only manage, but treating the complication is a problem. You see, that's why you are put on long-term medication. So there is a difference between treatment and management. Treatment is part of management, but there are some problems that when you are having them, we only manage the shortcomings, the symptoms, and reduce. Diabetes is one of them. You see, when you have diabetes, it depends with the kind of diabetes that you have. There are types of diabetes. When you have them, they can be managed, and you are okay. They remove the drugs, and you continue on well. But there are some problems that if you have diabetes and has a complication, you cannot stop taking medication. That is what we call continuous management. You will always continue and continue taking the medication because if you stop taking the medication, sugars go high. And management is for you to stay away from things that will make the sugars go high so that you cannot continue increasing the dose of sugar tablets. Now, we embark on what is the topic of today. Today, we are talking about diabetes. I know this is a very common one, and everyone learns about it, Googles, and sometimes even after you Google, you don't still understand what you are undergoing. You see, when if you ask someone what is diabetes, someone will always say a problem with sugars. Now we want to learn slowly by slowly beyond the sugar thinking and know what is diabetes, because sugar levels is the cause of diabetes, high sugar levels. Now, diabetes, what is diabetes? Is a chronic disease whereby the body has high sugar levels because it cannot produce enough insulin or cannot be cannot use insulin properly. You see, now this is just a sentence to describe what is diabetes. But there are some words in this sentence that we need to understand and know what these words mean. Mhm. When I'm saying insulin, do you know what is insulin? Yeah? Do you understand what is insulin? When you want to understand diabetes, you should really know what is insulin. Hmm? A minute, I connect this one. Now, you should really know what insulin is, because you cannot know how to manage diabetes, or you will never understand what diabetes is if you don't know what insulin is. Now, insulin is like a hormone. Insulin is a protein, a hormone that is a protein. Insulin hormone it is produced by the pancreas. You see, the pancreas is an organ in your body that produces insulin. And inside the pancreas, there are special cells. There are special cells called the beta cells. The beta cells that produce insulin uh, inside the islets of Langerhans. You see, your pancreas is modified to produce these cells, to produce insulin. You get it? Now, the main role is to regulate blood sugar levels. Because let's see, after you eat, you see blood glucose rises up in your body. Insulin helps, like in muscles and fat cells, take in glucose to use energy or store it as glycogen in the liver. You get it? So this insulin, when you take food and then it's broken down, then sugar levels come in. It is the one which helps you to take some glucose inside the muscles to get energy, and the excess glucose that is in your body to go to be converted to glycogen. Glycogen is like a store where, you see, when you've gone to the shamba, to the field, you've cultivated your maize and you have excess maize. You cannot use the excess maize at time. You will store it at a certain temperature in the granary. So insulin does that work. It will take the excess glucose, convert it to something called glycogen. Glycogen will be taken to liver. Now, the liver works as a store for glycogen. And what is the work of glycogen? Because now, when we talk about glycogen, this is uh, this is a, a, a store for energy. You get it? This is a store for energy. So if it is a store for energy, how does it work? How does it work? As because it's not now, you see, it's not it's not glucose. It is stored as glycogen. What happens is this. Beauty, welcome to the platform. We are talking about uh, diabetes today. And talking of diabetes, we are understanding the terms that are in the definition of diabetes, because we have talked about something here called insulin. So I'm trying to explain what insulin is. Is a chronic, you see, we say diabetes is a chronic disease whereby the body has high sugar levels because it cannot produce enough insulin and cannot use insulin properly. So what do we say? We continue. Now, when you are hungry, you have not eaten the whole day. The glucose that was stored in your muscles have been used. Remember, when you ate, glucose went up. And when it went up, insulin came in and converted it to glycogen, which was stored in your liver as a store. So when you are hungry, you have used every energy, the glucose that is in the muscle. Now it is time to convert the glycogen to glucose. That's why sometimes you can stay the whole day without eating and you are not collapsing. You get it? Because insulin did a great job to convert glycogen to glucose to glycogen to be stored in the liver. And there is another process of breakdown of glycogen, which is known as gluconeogenesis, conversion of glycogen to glucose. That happens when you have not eaten for the whole day, and now it's time to convert that glucose to, so that you can. Pamela Mullins. Pamela, welcome to the platform. This topic is critical and wherefore. Everyone, this topic is critical for welfare of most of black people. Yes, yes, Pamela Mullings, that is very important. And that's why I'll take this topic so slowly so that people understand. And if any question is put on the platform, if anyone raises any question, what will we do? We will try and answer that question properly, everyone to understand. No question should be left untouched. Now we continue. Now we have understood the work of insulin. That is the work of insulin from the pancreas of Langerhans to production of insulin from beta cells. Now, we continue. We had said that we have discussed what diabetes is. And main symptoms of diabetes when your sugar levels are high, because now we are dealing with high sugar levels, the main symptoms of diabetes are specific. Hmm? Because when you are having high sugar levels in your body, there are specific things that you will feel that will make you feel no, it is not right. You will start having frequent urination. Hmm? Thanks, Pamela Mullings. Thanks a lot. Just he- like the video, share, tell someone that here we discuss about health matters. And guys, please start telling me which topics you really want us to discuss about. Those topics that you feel you need us to be discussing about. You may be having something that you feel, let's put this in the platform, let's discuss it. Please always tell me. Just write or put it in the platform. I follow up. Now we continue. The symptoms that will make you feel that no, something is not right. You've taken a meal and your sugar levels are high. Your sugar levels are high. You know, someone will ask, normal sugar levels on the body. What are normal sugar levels in the body? What do you think? When you wake up and you feel like you are okay. Hmm? Now, I'll do them both in milligrams per deciliter and millimole per deciliter. In my country, mostly we use millimoles per deciliter. So when you take the blood sugar in the morning, when you've just woken up, the fasting, we call it fasting. No food for 8 hours. You've not eaten anything because when you take food, it's supposed to be in your stomach and digestion goes up to 8 hours. So the fasting sugar levels should be 700 to 999 milligrams per deciliter. You've not taken anything. That is 70 to 99 milligrams per deciliter. You see that? But in millimoles, per liter, which we use, yes, thanks a lot. Thanks a lot, Pamela Mullings. Thanks a lot. Let's share the information. In what we use, the calibration we use here, it is 3.9 to 5.9. Today, you notice I'm going very slowly because I've noticed when it comes to diabetes, people are really confused. Now, you've seen that 70 to 99 milligrams per deciliter, that is in milligrams per deciliter. But in where I am, we use 3.9 to 5.9 millimoles per liter. Before meals, preparadio, 3.9 to 5.9 millimoles per liter. But there is after meal, 1 to 2 hours. You've just taken a meal 1 to 2 hours after. It's supposed to be at least 140 milligrams per deciliter. You get it? 140 milligrams per deciliter. And then in millimoles, it is supposed to be less than 7.8 millimoles per deciliter, not exceeding 9. That is 2 hours. Because when you take sugars, go rise and then they start coming down slowly. When they are being, the insulin is changing, converting to glycogen, taking the energy to the muscles, it's using the food as digestion is going on. So that is how it goes. 1 to 2 hours postprandial. Postprandial we mean when after you've taken meal. Random, anytime that you feel you can take. You are not sure what time you ate. Let it not exceed 7.8 millimoles per liter or 140 milligrams per deciliter. Now that is the normal level. Now we continue with this um, discussion. What will make you feel that you know that you have high levels? What will you see? Every time going to the loo, rushing to urinate every time, excessive thirst, because high sugar levels take your fluid internally to the cells. You get it? So you will feel thirst, need wanting to take more fluids, and as you take more fluids, you are urinating. Increased hunger. We call it in medicine, when it is frequent urination, we call it polydipsia. If it is excessive thirst, we call it, if it is frequent urination, we call it polyuria. Sorry. If it is excessive thirst, we call it polydipsia. If it is increased hunger, we call it polyphagia. Phagia means swallowing. So hunger is related to phagia. Unexplained weight loss. You are not gaining any weight. You get it because the sugar that is in the bloodstream, the veins and the capillaries, is not converted into any stores, because this is how you gain weight. When you take food, the proteins are bodybuilding food to the muscles, but the carbohydrates, which are sugars, are converted to glycogen, and excess ones are converted to cholesterol. You see, you get it. So you will not convert them as it's needed because your insulin is not enough. So we continue. Yes, we call them like that. Minims per deciliter. In my country, we use the other way, millimoles per deciliter. Now, minims per deciliter is milligrams. Pamela Mullins, minims, that is milligrams. I know where you are in the US, you use milligrams per deciliter. Minims means milligrams per deciliter. But here we use minimals most. It depends. You can use either as long as you know the exceeding. Because I can see even here some people use milligrams per deciliter. Yes, we continue. Those are calibrations. You can use either. As much as you know, it's not supposed to be exceeding 140 milligrams per deciliter or 7.8 millimoles per liter. Now, we continue. Continuing very slowly. You will have fatigue. You are always tired. You're not viewing things well. Your eyesight is not okay. Slow healing wounds. And someone may ask, why do diabetic wounds slow in healing? By the end of this topic of diabetes, we will deal specifically with diabetic wounds. It is a very tricky and a very critical topic when it comes to wounds. You see, when your sugar levels are high and you have a diabetic wound, what happens is you have high sugar levels and bacteria are there continuously eating the sugar and the flesh. So healing becomes a problem. It is a complication of diabetes. Now, diabetes is high blood sugar level due to problem with insulin. That one we have said, leading to various complications. We have seen that and we have explained that. Now, when we come to a minute, um, when we come to types of diabetes, we have several types of diabetes that we will be discussing. We have diabetes type 1. Diabetes type 1 means you are born with, or when you are growing, an autoimmune disorder where an immune system destroys insulin producing beta cells in the pancreas, leading to absolute insulin deficiency. You get it? When in one of the videos we talked about what is autoimmune. Autoimmune means some of the cells of your body are fighting other cells. That is autoimmunity. So when comes to type 1 diabetes, it means either you are born without enough beta cells in the pancreas that produce enough insulin, or when you are growing when you are growing up, something started happening and you got autoimmune infection that is destroying the beta cells. You get it? And when the beta cells are being destroyed, what will happen? You will not have enough insulin. And when you don't have enough insulin, what will happen? High sugar levels, because nothing to convert insulin to glycogen and nothing to transport sugars to glycogen, and nothing to transport sugars to the muscles and the cells of your bodies, or whatever that is coming out of beta cells, too little to enhance the process. You get it? Now, the other one is type 2 diabetes mellitus. Diabetes mellitus. This one is a metabolic disorder by insulin resistance and relative insulin deficiency. The pancreas may produce insulin, but body cannot use insulin effectively. You understand? We will see how type 2 diabetes comes in. You are producing insulin, but the body cannot use insulin effectively. Our mothers, they have a special type of diabetes. A very special type of diabetes called gestational diabetes during pregnancy. Usually it's between 24th and 28th weeks. In a woman who has never been diabetic, we will see how it comes in. You see, these are types of diabetes that we will talk about, and we will talk about even management. We have talked about the first one, which is type 1 diabetes. We have talked about type 2 diabetes mellitus. And then we have talked about gestational diabetes mellitus. Just pinpointing gestational, we have seen it comes in pregnancy. We will see how it is related with the isolates of Langerhans, beta cells, and insulin. You see? And then we have other types of diabetes, the other ones, the other type of diabetes that are like maturity onset diabetes of the young. You see, genetic form diabetes to single gene mutation. Some single gene mutation may produce insulin resistance. So these are unspecified types. This is the fourth unspecified. And then we have secondary diabetes. When we talk about secondary diabetes, you understand, we're talking about diabetes that has come after you've got an illness. You saw when COVID was hitting, many people became diabetic out of nowhere. This is what we call diabetes secondary to endocrine disorders, you see, and secondary to drugs like glucocorticoids, thiazide, glucocorticoids, you understand, drugs like prednisolone, steroids, and then we have thiazide. The thiazide, like hydrochlorothiazide, it's an hypertensive drug, but it can. Hello, Majay, welcome to the platform. We're talking about diabetes. Welcome. Thiazides are hypertensive drugs, but they may predispose you to diabetes. And then we have antipsychotics. Some antipsychotics, remember when we were dealing with antipsychotics and psychotic disorders, we saw they may make you be diabetic. You see, this is related to drugs. And then we have autoimmune diabetes in adults. Latent autoimmune, slow progressive autoimmune diabetes in adults, sometimes mistakenly to type 2 diabetes. Sometimes you may mistake it to type 2 diabetes, but it grows slowly, eventually requires insulin, because some people, when they grow old, the pancreas starts to misbehave. It doesn't produce the same insulin from the beta cells as it was producing. And then you remember when our mothers were diabetic, we got some babies. Were pregnant and they got diabetes, we got some babies. So the babies can be diagnosed with diabetes. We call it neonatal diabetes. Hmm? Diagnosed under 6 months. Sometimes it may be due to mutation, genetic mutations for babies under 6 months. So that is uh, a special type of diabetes we will look at. We cannot do all this diabetes today, but we will see what type. But the first one we are starting with today is type 1 diabetes. Type 1 diabetes. There are some people are confused about diabetes type 1 and type 2. So, when we talk about type 1 diabetes, what do we know about it? What do what do we understand about type 1? This is what type 1 diabetes is. We have started with the first type 1 diabetes. Is a chronic autoimmune disease. You remember what we talked about autoimmune? Cells fighting against themselves. You see, you can have some cells in your body, there are some cells of immunity. I want to repeat that so that someone can understand. In your body, there are some cells of immunity that goes around your bloodstream, or they are at the tissue level, tissues or muscle levels. When there is a strange thing happening to your body, they fight that thing to remove it, because it's not part of the physiological function. It's not part of your body. So they come out to fight it so that it cannot destroy your body. But mistakenly, your cells that are surrounding, soldiers that are surrounding to remove strangers in your body, can mistakenly pinpoint to a certain cell and be confused and say, this is not part of us, and it is part of your body. You see, that is what we call autoimmunity. Automatic autoimmunity, automatic function that prevent your body from destruction. But here we see type 1 diabetes mellitus is a chronic autoimmune disease whereby the body immunity system destroys the insulin producing beta cells of the pancreas, in the islands of Langerhans. You get it? So in your pancreas, there are some places called the islands of Langerhans, and they have beta cells that sense when the insulin is needed, and it releases the insulin to go and convert excess to glycogen to be stored in the liver and transport some for energy to the muscles and tissues of your body, including the brain. You see, so the result of destruction of the beta cells that take care of releasing this insulin is deficiency of insulin. Because now, if they are destroyed, there is no enough insulin. Usually presents in childhood or adolescence, but can occur in any age. Because autoimmunity, you see, you can be predisposed to some things that can destroy your pancreas as you grow. Maybe you have a family genetic mutation disorder that can bring this type 1 diabetes, and it leads to the destruction of beta cells at the isolates of Langerhans of the pancreas. So most of these people are born with, but as you grow up, something can happen before you get to adolescence, and you start having an autoimmune infection that is destroying the cell. You get it? And now, Maureen. Yes, Maureen, welcome to the platform. We're talking about diabetes. And please, as we talk, like the video and advise me again which topic do you want us to discuss more? Which is the burning topic that you really want to listen to and know more about it? Yes, and that's why we started with mental health, but most of the people said, let's do hypertension, let's do diabetes, and today we are doing diabetes. You see that? Now we continue. We continue. What are the causes, triggers, genetics? Hmm? Genetics is the very first thing that you really need to think out. When you were born as a parent, once you were a child, and you had this, and you've been using drugs all through up to the time you are an adult, you can pass the genetic strain, the allele, we call them the allele, to your daughter or the boy that you give birth to. There are two genetic strains, the alleles that are called HLA-DR3 and HLA-DR4. So susceptible to mutations of destructions of the isolates of Langerhans, the cells that produce insulin. So we 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 really need to look at our genetic tree from your grandmother, yourself, and look at your children who you are giving forth. So even the other thing is genetic line. Now we go to predisposition. Predisposition, you can be working in a factory that produces fumes that may end up getting, maybe you start working at a very young age, like you are 16 or 18, because you see there are some countries where people poverty levels are so, and the children starts to work at a very young age, 18 years they are at the field working with the lead, fumes, sometimes at the quarries. And you see those fumes as they inhale, they are leading to destruction of themselves in the body, and the destruction of the cells end up to mutation. So these children, as they grow, because they are now coming to young adults, they start having diabetes because maybe the destruction of the cells have taken up. Now, autoimmune destruction is the main cause here. I usually explain autoimmunity so that you understand. I've just explained about cells of the body destroying the other cells. The cells of your body that fights are called the T cells, T lymphocytes. They're the ones which awaken when you have an infection. They're the ones which come and say, hey, this body is being damaged. Let's fight out this stranger that is here. T cells, T lymphocyte. They go and destroy the beta cells because they see the beta cells are like strangers. And there are some antibodies often present before onset. Anti-GAD. These are antigens that help your body isolate cell antibodies, insulin antibodies, something called ZNT8 antibody, zinc transporter antibody. This is the main issue before you are predisposed to something, and then these antibodies come in, present, and they release the T lymphocytes, T cells, and then the T cells goes to destroy the beta cells. See, autoimmunity. Now we continue here, we see environmental triggers like viral infections. There is a virus that is called Coxsackie B virus, mumps, rubella, cytomegalovirus, COVID-19, COVID virus. You can get them and they get to your body and destroy your pancreas. By destroying your pancreas, what happens? You don't have enough insulin. You cannot convert to glycogen or transport glucose to where it is supposed to be transported. This is what happens. Immunity attack, destruction of the beta cell. Insulin is destroyed. Insulin goes down. And when the insulin goes down, glucose can't enter insulin-dependent tissues, muscles, fat. It cannot, because there is not enough insulin. Hyperglycemia develops. Hyperglycemia means high insulin levels in your body. We have talked about the levels of insulin that you are supposed to be having. Understand? Now, you get to a condition called osmotic diuresis. Osmotic diuresis. Diuresis is something that is called losing fluids. Osmotic diuresis. If anyone you've ever told by your doctor you are having osmotic diuresis, just know the doctor was telling you that you are losing fluids. Osmotic diuresis is a type of increased urine production that occurs when certain substances in the kidney, you see the kidney is the one which filters tubules onto water because they can't be reabsorbed. You get it? We have mechanisms of osmotic diuresis. I'm just explaining how when you are diabetic or when you are finding out you are diabetic, you urinate a lot. This is how it happens. After the kidney filters plasma, when it filters plasma, most solutes, think we need to, I remember I'll get it, I'll show you. So the glucose must go back to the body. Let me draw it. Glucose must go back to the body. You remember me drawing something like this one? This is what I drew. This is the kidney. Let's say the left kidney. And then there is the other one here. Now, the kidney looks like this. But this one, let's say, is the afferent that brings in blood. You get it? And there is one that takes out blood. But this one is the ureter. This one is the one that takes urine to the bladder. Urine to the bladder. Here are some two. So here we have some small tubules. You see here we have two. The one that comes in and goes out. But here is the one which passes urine to the bladder. The bladder is whereby you are waiting for the urine You are waiting for the urine to be removed from your body. But let's talk about these two blood vessels, this one and this one. We want to know how the kidney works. This is a diagram that I'm just explaining. The blood comes into the kidney and then it goes out. You get it? Now, this is what happens. This is the normal function of the kidney. Inside here, what happens inside here is this. There is something called small tubules like this one. But this tubule, blood comes in, this side is wider than this side. They are called the glomerulus. Now, when blood comes in, it is wider, so it is pushed to a very narrow pipe. And what happens? If you push blood from a wide pipe to a narrow pipe and it is porous, let's say it has some openings, what will happen? It will come out. The solute, the fluid will come out. You see, this is blood. But when it comes out, this is what happens. There are some capillaries that have crossed around this, like this. So it is being pushed to come out of the field of the blood stream, because the afferent tubules and efferent tubules, they are not the same size. The other side is smaller than the other side. So the work of these capillaries is to absorb. Now it is pushing, some glucose is coming out, some sodium is coming out, but whatever that has gone around is absorbing the glucose that is coming out and is taking it back to the bloodstream. You get it? It is absorbing the necessary solutes that are needed. So the necessary solutes here are like glucose, sodium, we have phosphorus. There is something that does not come out, proteins. Proteins does not come out because they are large crystals and they cannot come out of these small openings. Remember the mechanism that we have said. This side is bigger than this, and there is pressure of pushing the blood. So when there is pressure, some fluids come out. Some fluids come out, and when they come out, these capillaries are absorbing the glucose, are absorbing the sodium, are absorbing the phosphorus. So glucose does not go because there is something here that is collecting the fluid that is coming out here, and it is going. Now that something is what is collecting to this pipe, taking the fluid to the bladder. You get it? So what is not needed is not being absorbed here to this. It's not being absorbed. The fluid comes down here. This happens around here. The fluid comes here and it goes to the bladder. So what is needed is absorbed and is taken back to the bloodstream. We call this the loop of Henle. The loop of Henle. And there are so many loop of Henles here doing the same job. And that's why you absorb everything. Every glucose is absorbed inside and back to the bloodstream. As this one pushes and releases some fluids here, it's absorbed back to the bloodstream. So when you have high glucose in your body, when you have high glucose levels in your body, most of it will not be absorbed. You will find it in urine. You are not supposed to find any glucose in urine for normal when it is normal, you are not diabetic. So, but when you are diabetic, when these capillaries are absorbing, more will remain because they don't have the capacity to absorb more to go back to the bloodstream. That is what happens in the kidney. There is a topic that is coming that we will deal with the kidney alone. Don't worry, but if you have not understood something, the physiology there, which is shallow, just ask, I'll explain, please. We were talking about why you urinate when you have diabetes. Normal. After kidney filters plasma, plasma is the fluid that I was saying it is passing in the glomerulus here. When it is filtered, most solutes, now solutes are the glucose, the sodium, the phosphorus, you see, all those are reabsorbed back in the tubules. Water follows solution reabsorption by osmosis. You see, now sodium, when sodium goes back, water goes back because water follows sodium. So it remains a bit here that goes to the bladder. In osmotic diuresis, when you are diabetic, an osmotic active substance, e.g., glucose, mannitol, urea, is excess, remains in the tubular lumens. It remains in the lumen. You get it? When it remains there, this increases osmotic pressure because now the sodium is not getting in, it's not getting along with water. You get it? Prevents water from being reabsorbed because now we have a problem here of high sugar levels here. It's not balanced. Hmm? And when it's not balanced, what happens? We have a problem of reabsorption. We understand? Hmm? You get it? We have a problem of reabsorption. So we continue. That is why you usually urinate so much when you have this problem. You usually urinate because there is no sodium that is going on, so there is no balance. The solute remains with more water and you urinate. Yeah? So large volumes of dilute or slightly concentrated urine. So we continue. We were talking about osmotic diuresis. When you have high sugar, diuresis leads to dehydration because as you urinate, you become dehydrated. Remember, we are talking about diabetes type 1, where you are born by low amount of isolates of Langerhans or beta cells, or you have been growing before you reach 16, the cells in the pancreas, they are destroyed by something, autoimmunity. You have a genetic mutation and your cells are killing the other cells. You see? And then after that, we see the fourth one, fat breakdown increases because now you need more energy. And you see, if you don't have enough balance of sugar levels, what we need will the body do? Will start breaking down fats to get the energy. We call it lipolysis. This is why people that have cancer, they are thin. Most of them are thin because cancer cells uses a lot of energy, and the next place they can get energy is to break down the fats that you have in the body. And then it produces excess ketones. Ketones. Ketones are products of breakdown of fats. Ketones. You get it? So we may ask someone, we went to a hospital and you a minute. We went to a hospital and we were told he got diabetic ketoacidosis. What could be the problem? A ketone is a compound, two-sided, that is not a good thing. Ketones offer it is water soluble, produced from fatty acid destruction, hmm, fasting or uncontrolled. You get it? That is what we call ketone. Kidogo tu, kidogo na. You see that? That is what we call ketones. When you break down fats to get energy, you get ketones. And that's why people that are diabetic, some people are thin because they continuously go on and destroy their fat. Now we continue the pathophysiology of diabetic, the how diabetes type 1 comes out and how you urinate and the kidney function, the way I've explained, is a very important mechanism to be understood, especially when it comes to how you cannot convert glucose to glycogen. Here, I want you to listen to this. We have destruction of cells. You get it? Type 1, we deal with the destruction of cells in the islands of Langerhans. That is a very important point that you should note. And then we have talked about osmotic diuresis, how you end up having a problem of urinating. We have talked about it because this thing that have drawn here, it's called the glomerulus. I've talked about how it absorbs glucose and other solutes like sodium. And when you take sodium inside, it will go with fluids. You get it? So when this one is being pushed and some solutes are coming out, sodium goes back to be absorbed and it goes with water. But now you have high sugar levels and the balance is not there. What will happen? More sodium will be out and you will not have water that is going back to the veins, the arteries. So fluid will remain here. As you take fluid, it's remaining here and it's dropping down to the bladder. That's how you urinate. You get it? Now, we continue. This ends up to polyuria, excessive urination. You continue urinating. As you take water, you are urinating. Excessive thirst. You are always thirsty. Because now the sodium balance is tempered with. No sodium is carrying water back to the bloodstream from the kidneys. And then we have polyphagia, excessive hunger because you need more energy. Everything is not okay. You are breaking down fats and you still need to eat. And if you really if you ever been with a person who is diabetic, at times this person may tell you, I'm eating bread and I'm feeling it so sweet. It's because this person has excessive, the body is telling this person to eat more of it to produce more sugars. You understand? Because the balance has been tempered with at the kidney level and the pancreas. So the main place that we are talking about when we are talking about diabetes, Kali MTN, where do I repeat? Please be specific. I repeat. Tell me where you want me to repeat. Okay. In diabetes type 1, let me repeat. We were about the sugar part. About the sugar part. Which one, Kali? Which sugar part? You see, we are dealing with sugars, balance. And I've said when you are dealing with diabetes type 1, the main organs, pancreas, islets of Langerhans, and beta cells. Oh, where someone says they want to eat more. Okay, Kali, I've said if you've ever been with someone who is diabetic and he's eating bread or something that is starch, once or twice you'll hear this person telling you that this bread is so sweet, I want more. It is because at the brain level, the balance has been destroyed in the body. The body needs more sugar because you need more energy. Hmm? You get it? You need more energy. Thank you, Pamela Mullings. Thank you, Pamela Mullings, for that recommendation. You need more energy to destroy the fats to create more sugars, because gluconeogenesis is a process of destroying cholesterol to glucose. Production of glucose from non-carbohydrates. So when you're taking that bread, your bread, the autonomic system tells you this bread is so sweet. There are some hormones that will tell you this bread is so sweet. Please add more. And as you add more, what is happening? More sugars are continuing, and you will get to ketoacidosis, because as you take more bread, more energy is being taken to breaking down more cholesterols, and you are forming things called ketones, which are not good. You will end up to have diabetic ketoacidosis. I think, Kali, I've tried to explain well at that point. I think that one I've tried. We will talk about the hormones that help to regulate hunger and so when that time comes. Now, classic symptoms of this. What is the classic symptoms when it comes to diabetes type 1? Polyuria, excessive urination. I've explained how someone can urinate. Polydipsia, excessive thirst. And you've seen why you will have thirst. The kidney is removing more fluids. And then we have polyphagia, excessive hunger. You are always hungry because you need more energy. Other signs may be because you are breaking more cholesterol and fats, you will have weight loss. Fatigue and blood vision, high sugar levels. We will see how high sugar levels affect vision. You get it? Bedwetting in children. You see, this is type 1 and mostly is in children. So you are always concerned, my child is always bedwetting. You never know that this child maybe might be undergoing diabetes. So if you have a child who is bedwetting, please always take this child to a doctor. There are some tests they'll do, and they'll try to advise you ABCD. You get it? In severe diabetic ketoacidosis, you will get some people having abdominal pain, vomiting, rapid breathing. We call it in medicine Kussmaul breathing. That one. Because there is no balance in the body. And then when you listen to you move closer to them, you feel their breath is always some fruity breath, sweet breath, because ketones are products of carbohydrates. Carbohydrates, they have fruity, sweet smell. We call it acetone. If you have ever seen a person struggling at diabetic level, you will feel this person has a smell that comes in from the mouth. This is called acetone. So that is how diabetic type 1 comes. I've really explained how it comes, and this is a topic that I'll move so slow because I want everyone to understand. You remember, today I've just talked about what is diabetes, and I've gone to diabetes type 1. I have explained how it comes and the destruction of cells. Tomorrow, we are going to deal with specifically how to deal with diabetes tomorrow or on Monday. Mostly on weekends, we have so many issues. So the next video, we will do how to diagnose. If you have a question, this is now an open channel for questions. If you have a question, it is time to ask a question, because the next video we are going to deal with how to deal with diabetes type 1. How to deal with diabetes type 1. So today we have dealt with what is diabetes, how does diabetes type. Yes, I'll do it on Monday. In weekends, I'm so busy, at times I don't have time to do it. So we have dealt with the pathophysiology, how it comes, and how we know this is diabetes, and the signs, the 3 signs of diabetes. We have dealt with it. So we will deal with diagnosis and treatment on Monday, and I'll talk about other things before I deal with diagnosis, on how diabetes type 1 can make you not to see well, and I'll talk about other hormones that come alongside diabetes type 1. So if there is no question for the day, we are more than 1 hour. Thanks a lot on being on the platform. I appreciate you. Please like and share the information. Share these videos so that I grow and we grow together. Thanks a lot. Have a lovely evening. Be blessed, everyone.